Good evening, one and all. I am Dr. Srivatsan Ramani. I am a consultant urologist and andrologist at Apollo Spectra, MRC Nagar, Chennai. So, today we are going to talk about stone disease. Um, Being in Chennai and being in India, our population itself is very much prone to developing stone disease. So, what is this stone disease and why are we so concerned about it? Stones or kallu, as we call in Tamil as well, is a ever perennial problem that has been in India for last so many centuries. It's attributed to the climate and environmental causes that the incidence of stone disease is very high in India. Almost 1 in 3 people will suffer from stone disease at least once in their lifetime. Now, why are we worried about this and why do we have to consider this as a hazard? Basically, stone disease is a very nagging disease. It will most probably hurt you a lot, that you will have to take some time off in order to take care of that. This leads in turn to loss of working days, loss of pay, loss of money in view of this treatment of these health issues, and so many other factors as well. On top of all these things, this health issue can have hazardous effect over the kidney in the long run, and it is a recurrent problem. Almost 50% of the patient have recurrent stone issues in the first 5 years of their first symptom of stone disease as well. So, considering all these things, it is very essential that we be aware of the problem which is caused by the stone disease. So basically, kidney stones are one of the commonest disease that we see in our OPD as well. It is attributed to the supersaturation of the urine. Now, what is that? As you know, how salt is formed in the seawater, according to the evaporation, when the concentration of the salt in the seawater is so very high, and once it is evaporated, it crystallizes to form salt crystals, which is basically sodium chloride, and then it is super added to form salt. In a very similar fashion, when your urine is supersaturated with solutes, like whether it's calcium or oxalate or sodium or uric acid, it starts crystallizing in your urine. Once that happens, the crystals get together and form a bigger aggregation called as kidney stones. Now, this is the what I would call is a very basic mechanism by which stones are usually formed. In addition to all these things, you can also have infections or other diseases like hyperuricemia or high uric acid levels. Also, certain drugs which can cause the increase in the crystalluria in your urine and thereby leading on to stones as well. The most commonly used drug that can cause this stone disease is allopurinol, which is used, and also you can use iacyclovir. It's an antiviral that is used. It can cause crystalluria and cause a stone disease as well. Now, considering that, what is the commonest type of stone that we usually see? The commonest type of stone that we see is called as a calcium oxalate monohydrate or dihydrate. These are the calcium oxalate stones, which are actually very hard stones, and this is the commonest stone that we get. The second commonest stone is the uric acid stone, which is quite common, especially if you are a non-vegetarian eater and you eat a lot of non-vegetarian diet. You can have a increased uh, uric acid excretion in the urine, thereby leading on to uric acid crystals, which can lead on to formation of other calcium stones as well. Now, in addition to all these things, the most common reason I would say is basically dehydration. If your urine is concentrated, if your continuous hydration of the urine in the kidney is not present, this can lead to the stone formation. Now, there are people who come to me saying that, sir, I drink 3 liters per day, still I am getting a stone, which is quite surprising. Then they tell me that I drink 1 liter in the morning, 1 liter in the afternoon, and 1 liter in the evening. Thereby, why am I still getting stones? See, it is the continuous hydration of the urine which is very, very important. Not that you drink 1 liter at a time and that is going to get excreted in the next 1 hour. And again, your urine is going to go for concentration at the end of the first or the second hour, thereby leading to crystal formation. So, continuous hydration, what is the meaning of that? Every couple of hours, a couple of glasses of water or any form of liquid for that matter is what is called as a continuous hydration, except in the night time when you are sleeping. Other than that, when you are having this regular hydration, the chances of you developing crystalluria is very less. And even if the crystals are formed, they get flushed out in the urine, thereby not letting it aggregate into stone and thereby protecting you from stone disease as well. Now, what is the symptoms that you can develop once you have a stone? Now, once a patient has developed a stone colic, as we call it, or renal colic, as we call it, that is the pain related to stone, you will never forget the pain at all for your life. It is so severe. It is it is akin to a labor pain that the mother undergoes while delivering the child. It is that severe. You cannot work, you cannot do anything. You have to come to the emergency for pain relief. Otherwise, it will be like really, very, very harsh pain that you could have to suffer through. Now, why does this happen? Why do you get this kind of a intense pain? So whenever a stone comes down the tube, so there is a kidney which produces the urine, and there is a plumbing system of the kidney which drains the urine from the kidney into the bladder, which is the urine bag which collects the urine. Now this tube is sadly only 2 to 3 millimeter in width. It's a very, very tiny tube. It can probably expand up to twice its size, which is about 6 millimeter, and thereby, if any stone which is less than 6 millimeter, the chances of it passing out through this tube is very, very high. But this stone or this crystal can be, spiky. It can have small speculations which can go, and like how you anchor the ship, it can go and get impinged onto the tube, thereby causing you the pain. Because it hurts the mucosa of the tube, it can also lead to bleeding in the urine as well. In addition to all this, when this stone comes down, the tube is trying to push the stone out. That is when you develop a very, very severe pain as well. And once it blocks the tube, the urine gets accumulated before this stone, thereby engorging the kidney. The kidney gets stretched, and thereby you get a dull, aching pain in the kidney region, which is basically the loin or the back. So these are the main reasons why you develop a pain once you have a stone that is coming down. In addition to this, the stone blocking the tube can lead to infection of the urine on top of the stone, especially if you are a diabetic, which is very common these days. You can have an infection of the urine on top of the stone, thereby leading to even more pain, thereby leading to bacteremia, that is entry of the bacteria into your blood, and you can even land up in septic shock or sepsis and land up in ICU as well if it is not treated urgently. So this is the most important cause of the pain when you come to stone. Other than that, as I said, you can have blood in the urine, you can have fever, you can have passing of the stones through the tube and other things. So these are the other symptoms that you can undergo. But the pain is a very, very characteristic the symptom of the urinary stone. And once you get that pain, you will never forget the pain in the entire life as well. Now, what basically entitles the treatment of the urinary stone? Now, the treatment of the urinary stone depends on two things. One, what is the characteristic of the stone? What are the characteristics that we look at? So we look at the size of the stone, we look at the nature of the stone, we look at the composition of the stone. Basically, what is the stone made up of? Is it made up of hard substance, or is it made up of soft substance? So these are the three things that we look at once we realize that the patient is suffering from a stone. These are the things that we look at. So how do we evaluate this? How do we get to know what kind of a stone and what is the type that we need to treat it as well? So the most important gold standard test that we do is what is called as a CT scan KUB of the kidney, ureter, bladder region. That will tell us, this is a plain CT. It can be done within 5 to 10 minutes. It will give us all the information, almost all the information that is required to proceed further with the treatment of the stone. Now, basically, other than that, we also do your kidney function test to make sure you're all okay with regards to the kidney function. We also check the blood test to make sure that you do not suffer from any infection due to a kidney stone and so forth. Once we have the CT scan report, then we decide on the what type of treatment would be appropriate for you. As I said, the second most important factor that we enroll whilst deciding what kind of a treatment that you require is that where is the location of the stone? Is the stone located within the kidney? Is it located in the tube that drains from the kidney to the bladder, or is it located in the bladder? So this determines what kind of a treatment that you will have to undergo. If it is located in the kidney or in the upper part of the plumbing system or the drainage system of the kidney, then there are three options that can be used depending on the size and the location. So if it is more than 2 centimeter or 1.5 centimeters, so we can either put a small endoscope through the urinary passage and break the stone with the laser. But if it is too big, then we may have to make a small puncture into the kidney itself, approach the stone through the kidney and break it into pieces. Now we have the latest technology to break these stones, which is the laser technology. With the help of the high-powered laser, usually 100 or 120-watt holmium laser or a thulium laser, these are the latest advances in the laser machinery as well. We are able to fragment the stones into very, very fine powder or small pieces which can be retrieved. If we break it into fine powder, we let the urine, it drain into the urine and come out through the bladder. If it is made into a small fragments, we remove it through the basket or a grasper and send it for analysis to understand what type of a stone that it is, crystal that is made of. Now this will help us in the future treatment and in the future prevention of stone diseases as well. If you have a stone which has come down the tube, then probably we can put in a small endoscope through the urinary passage itself and thereby break the stone inside the tube, and generally we will remove the stone bits as well. Now, as I said, what is the difference between puncturing a kidney and doing endoscope is that if we do a retrograde endoscopic surgery, that is through the urinary passage without making a nick into the kidney as well, this is a completely endoscopic procedure. There is no cutting, there is no stitching, there is no opening into the kidney, no hole in the kidney, nothing. So it's a purely endoscopic procedure. Now, by this, you don't have a recovery period at all. You are as good as new after coming out of the or operating theater as well. The usual stay in the hospital is less than 24 hours, and you can be back home and back to your work within a couple of days as well. However, it also depends on the size of the stone. If it is a too big a stone to go through the endoscope and break it continuously, because it takes a little bit time to break the stone inside the tube, sorry. So if it is more than 1.5 to 2 centimeter, it is too much of a time to stay inside the tube and break it as well. Then we will make a puncture into the kidney that is faster and easier for you as well. Now, coming into the other portion, which is the ESWL. Now, many people ask, sir, can we undergo shockwave lithotripsy to break the stone as well? There are certain indications to break the stone using shockwave lithotripsy. Now, to understand that shockwave lithotripsy is not a surgery, it is focusing of hypersonic waves onto the stone from outside with the help of image guidance, either an X-ray or an ultrasound, thereby focusing the stone and breaking the stone into bits and pieces. Now, what happens is that this ultrasonic wave is focused only on the stone. The stone will absorb the energy and slowly disintegrate from within. Even if it breaks into a couple of pieces, it can easily pass out through your natural passage. Now, there are certain advantages and certain disadvantages in this. The advantage is that you don't have to undergo a procedure, you don't have to undergo a DJ stenting. So it is, you come, you get your stone broken, and you can go back home within an hour. The second point is you have to pass the stone by yourself. So if there is a bigger piece of stone that is coming out, it is going to be a little painful. It's not going to be painless as well. Second thing, if, for example, there is a lot of obesity, there is a lot of fat, if the stone is at a location which cannot be visualized properly on the X-ray or ultrasound, the breaking of these stones is going to be difficult. It's not going to be easy to break the stones by using a ultrasonic wave therapy as well. But however, if it is focusable, it is one of the best modality of treatment whereby you can break the stone without doing any surgery as well. Now, coming on to these were the various treatment modalities for stone disease. Now, coming on to, is there a way to prevent the stone? So, as I tell all my patients, there is only two important instructions that needs to be followed. One, as I already told you, a continuous hydration. You have to keep yourself hydrated. The most common question people ask me, how much water or how much liquid should I take? Now, liquids other than carbonated beverages is very, very important. People should not drink carbonated beverages if you are suffering from stone. Liquids include water as well as other fluids like tender coconut water, buttermilk, lassi, or whatever, even rasam for that matter. You can have about 2.5 to 3 liters per day. If you are sweating, for example, now it is like really very sunny in Chennai, so you're going to sweat a lot, or you're exercising and losing sweat, you can add another 500 to 700 ml more to your fluid intake as well. This is very, very essential to prevent stone formation in the future. The second thing, most proven thing that you have to do is to cut down on your salt intake. This is very, very important. Only the salt that is used in the cooking, no extra salt like in snacks, in chaat items, in fries and other thing, even tomato sauce for that matter, are all very high salt content foods. So it's better that you avoid these salt content foods in order to prevent the stones. Now, these two are the most proven and the most significant changes that you'll have to make to your lifestyle in order to make sure that you do not develop stone, or at least postpone the distance between the two episodes of stone disease as well. There's other anecdotal things that is say, including plantains that we will commonly hear in Tamil Nadu, that if you have a plantains, then you will have the stone getting removed. There is also anecdotal that if you drink a beer, it will flush out the stones. Now, all this is based on the fact that it causes hydration, it causes diuresis. Diuresis is increased urine output, thereby it can help in that. But again, these are all anecdotal. There is no real proof of those things. There are also certain food materials, and there are nuts, rhubarb, chocolates, which are very, very high in calcium, oxalate. Thereby, it can lead to stone formation. Another myth that usually runs around in our communities is that if you are a stone former, you have to completely stop milk intake. That is completely wrong. If you completely remove milk from your diet, you are actually at a higher risk to develop stone. Why? Because your food already has oxalates. If you take calcium along with the oxalate, they get combined together, so the oxalates are not absorbed. If you do not take calcium at all through the milk intake, the oxalate is going to be absorbed. You already have calcium in your body. It is going to form calcium oxalate, and you are going to develop stones. It is imperative, not excess of calcium or milk. You have to take at least a couple of glasses per day in order to make sure that you do not develop calcium oxalate stones. So with that, I think I've given you a brief overview of stone diseases in India. So I think with this, we can move on to Q&A session. And I'll try to answer a few questions with regards to the stone diseases as well. Thank you.
Hello, sir.
Hi.
Sir, how to dissolve kidney stones naturally, sir?
So there is no medication per se to dissolve the stones naturally. There are some diet things. I know there are some Ayurvedic and non-allopathic products that is available in the market to dissolve the stone. So let me tell you the basic concept between trying to dissolve a stone. Now, you all know that our urine is generally having an acidic pH. That is in order to make sure that we do not get infection, because if you have an alkaline pH, you can have a higher risk of infection. However, this acidic pH is the one which prepares us to develop stones, because uric acid and everything gets deposited in the acidic pH. So if you can convert this acidic pH into an alkaline pH, then it is possible that, one, we can prevent the crystallization of this uric acid. Second, you can actually try to dissolve very tiny stones as well. So we generally initially we used to use what is called as a sodium bicarbonate. We used to use colloquially citralca. Everybody used to give citralca. Nowadays, because of the gastritis issues with citralca, we give potassium magnesium citrate. Now this converts the urine pH from acidic to alkaline, thereby trying to dissolve the small stones, not for a very big stone, but small stones, but it definitely prevents the formation of future stones. So we usually give about 3 months of this therapy so that we do not develop stones in the future.
Okay, sir. Thank you. So can these stones be hereditary?
So that portion I've not spoken about. So basically, if you have a family history of stone disease, there is a very high chance, 1 in 2 chance, that you may develop stones as well, especially if you have a close family like father, mother, or a sibling suffering from stone disease. There is a very high chance in 1 in 2 that you may also suffer from stone disease as well. Now, there are various reasons to that. There are a lot of metabolic reasons that why you could suffer from this. The second thing is that the metabolic syndrome itself is also hereditary, multi-pronged hereditary that is there. So you can, for example, your mom or dad is a diabetic, and you can also develop diabetic and land up in stone disease as well. Obesity and diabetes are the two major factors that we are finding to be the cause of stone. And again, these are hereditary as well, the syndrome HEGS that we call. Other than that, there are also hereditary like cystinosis and cystine stones and all those things. Though these are all reported, the percentage of stone formation due to hereditary causes is actually less than 10%. Most of the stones that we see are all idiopathic. We do not know the reason for the stone. So generally, when a patient walks in with a stone disease, we do not do a complete metabolic evaluation. However, if you have family history, if you are a very early, like a child developing a stone or a very young person developing a stone, or you have recurrent stone like 2 to 3 episodes, which is continuously recurring within a year or a couple of years, then you will have to undergo what we call as a metabolic evaluation. That will tell us what is the changes in the blood that could have led to the formation of the stone. That is a abbreviated protocol that we generally follows, which includes you do your serum electrolytes, you do your cysteine levels, oxalate levels, and other levels to find out that whether we can find out a cause for the reason for the formation of recurrent stones, and thereby treat that reason in order to prevent the future formation.
Okay. So how effective is the ureteroscope in treating kidney stones, sir?
Well, ureteroscope is very effective in treating ureteric stones, basically. That is why it's called a ureteroscope. So ureteroscope is nothing but a small endoscope. As I said, the tube is about 3 to 6 millimeter in width. The ureteroscope is about 4 millimeter in width. So we try to pass this small endoscope through your tube that connects the kidney to the bladder and localize the stone and try to break it and remove this thing. So it almost has a 99 to 100% clearance rate.
Okay.
We can clear the stone because you are doing it under vision. If you can see the stone, you can clear it 100% and thereby relieve the patient of the pain as well.
Okay, sir. So can the kidney stones be cancerous?
So kidney stones by itself are not cancerous.
Okay.
However, if you have a long-standing stones, for example, years together, you're having stones in your kidney or generally in the kidney, but sometimes in the tube as well, like a renal pelvic stone, the continuous irritation of the stone, the secondary infection that it causes can over a period of 5 to 10 years lead to the formation of squamous cell carcinoma. That is the commonest cancer that we see in relation to stone.
Okay, sir. Sir, how long does a person take to recover from a kidney stone?
If treated, then they recover very fast. Okay. So basically, as I said, most of the surgeries for kidney stones have now become day care. They get discharged within 24 hours. The only problem that we do face is that we may have to put a stent once a surgery for the stone disease is done, because these stones are basically very tight and they get stuck at the place which is very tight. So it impinges on that area and causes a bit of ulceration. We can remove the stone, but once we remove the stone, these ulcers at the ends of the tube can stick together, thereby again blocking the tube. So in order to prevent this blockage, we put a stent between, like a splint between the walls of the tube, so that they don't stick together and heal together. So this stent is the one which creates a little bit of issues, but then this is put on a case-to-case basis depending on the requirement.
Okay, sir. So is there any vegetables that can cause kidney stones and which is need to be avoided?
Right. As I said, the anecdotal reports of vegetables causing kidney stone is basically because of the high oxalate content. The non-vegetarian diet, as I said, is very high in uric acid content, whereas the vegetarian diet is very high in oxalate content. Especially when you take seeded vegetables like tomato, you have lady's finger and other vegetables, they generally have a very high content of oxalate as well as uric acid. So these are generally they say that try to avoid that, especially tomato is omnipresent in our cooking, whether it's sambar, rasam, or whatever they do. It's usually they crush the entire tomato and use it. So what I suggest to my patient is to remove the seeds and use the flesh of the tomato to cook, and similarly to other this thing. The second thing with regards to fruits. So when if you're eating the whole fruit, it's fine. But if you're going to make a juice out of it, for example, a grape, you're going to grind it with the seeds, it's going to get mixed with the juice and going to lead to the issue. So we generally try to ask them to avoid those things. But anything with the seed, you can take in moderation. If you can remove the seeds, that will be excellent as well.
Okay, sir. So what is the age group that is getting affected by the kidney stone?
It is the younger people which usually gets affected with the kidney stone. Thankfully, it doesn't affect the very elderly population. So it's usually common between 20 to 50 years of age. Basically, the working population, that is the reason of this talk itself. One, because they are the people who's exposed to the environment more commonly. They work in certain environment. It's either of the two. They work in a very, very humid or hot environment, or they work in a complete cooled setting, so they forget to drink enough water as well. So these are the commonest thing. In sexes, it's more related to males develop more commoner incidence of stone disease than females. However, we have been seeing an increasing incidence of stones in females, especially during the peri-pregnancy time and the postpartum time as well. So these are the commonest population that we see of stone disease as well.
So can the kidney stones cause erectile dysfunction?
There's no correlation between kidney stones and erectile dysfunction at all.
Okay. Last question, sir. So what is the cost of kidney stone test in India, sir?
Kidney stone
test? The basic test.
So kidney stone test is actually done in two different ways. One is a X-ray diffraction method, which is not so costly, and you have the crystallography method, which is a little costlier. So, but basically it costs somewhere between 700 to 2,500. So that's the maximum cost for kidney stone testing.
Okay.
You're talking about the imaging or the crystal testing?
So the basic overall, the basic test, to whether the person has stones or what.
Okay, so it starts from the imaging then. So probably you'll require a CT scan to find out the stone, the location, and so forth. So CT scan nowadays is not so costly. It's a plain CT, so somewhere around 2,500 to 3,000. So, but definitely it's going to be an economic hazard to the patient, that's for sure. Because one, you're going to have pain, so you're not going to be able to work and all those things. And second, if you're going to get treated for that, that's going to be a definite financial constraint to the patient as well. So it's better to have a preventive method to not getting the stone rather than to treat it later as well.
Yeah. Thank you, sir.
Thank you.